Hello and welcome to the Lancet Voice. It's February 2026 and I'm Gavin Cleaver. I'm joined once again by Richard Horton, Editor-in-Chief of The Lancet, and Jessamy Bagenal, Publishing Director at Elsevier, to discuss the world of Lancet publications and global health news. This month we're looking in detail at health in India off the back of our new India Commission, and we're talking about global health funding cuts. We hope you enjoy the conversation. Richard, Jessamy, welcome back to the studio. It's been a while, I think, October last year since we all last sat down and chatted with each other, and a lot has happened.
I missed you all. And Jessamy left.
And now Jessamy left the Lancet, yeah, that's the headline.
She's now making a guest appearance.
Are you on loan from Elsevier?
Temporarily, just, yeah, and by the minute, really, it's...
The cost is adding up. How has your new role been?
Very good, very good. It's very interesting to understand publishing from a new angle.
What is the full title that you now have?
I'm Publishing Director of HMS5.
It sounds a little bit like a boat of some sort.
I feel like it's very pragmatic. We have 190 journals and they cover surgery, orthopedics, max facs, vascular, endocrinology, pediatrics, diabetes, some internal medicine. A real mix. How's
your last 6 months been, Rich? I assume you're still in charge of the Lancet.
They haven't got rid of me yet.
Yeah.
No, it's been super busy. We had a great end of year. We had this series on ultra-processed foods, which got a lot of attention, more attention than most of our series get, because everybody in the world is just completely wired about ultra-processed foods and how dangerous they are. So that was great. But we've been watching the world unravel, haven't we, really, Gavin? I mean, I think it's been, the last 6 months has been a pretty depressing time, just looking at it from a helicopter view. We've seen more attacks on science, RFK and his quest to destroy the established evidence around vaccines has been deeply problematic. The institutionalization of disinformation across many scientific agencies such as NIH and CDC, in the United States, is deeply worrying. We've seen the full extent of the cuts at the World Health Organization be delivered. It's good that those are over and the WHO can start afresh in 2026, but we've really seen some pretty savage reductions in personnel and therefore narrowing in the scope of what WHO can do. So I think it's, we've got to retain our optimism and try and build on what we've got. And so I would say the role of scientific journals and in our little corner of the world, what the Lancet does is even more important than it's ever been. But it's been a pretty tough time, I would say, the last 6 months.
I was going to say, even as a kind of news junkie, I've completely lost track of it by this point. It feels like every week something different and terrible, and something that in a previous time would have been almost kind of era defining happens anew every week or so, it feels like.
Yeah, the rules-based order that we've based so much of our lives around in health and development just seems to have been ripped up. And we've got an editorial in this week's issue on the situation in Venezuela, written by one of my colleagues who is Spanish and so is therefore able to make contact with individuals in Venezuela who know exactly what the situation's like on the ground. And the situation in Venezuela for 20 million out of 28 million people are living in poverty in that country. And Maduro, nobody wants to defend what he did, but the way that the United States came in and decapitated a regime in a country, even a regime as bad as Maduro's regime was, and then essentially appropriate the oil reserves and have this extractive approach to the resources that Venezuela does have. This is not the way the world should be run. And in the editorial, Bea, my colleague, has described the situation for health in Venezuela, 20 years of it being driven into the ground on a background of several hundred years of colonialism. But the situation today is really, really appalling. And the United States, as well as the new Venezuelan government, ought to be paying a lot more attention to the health and well-being of its people. At least that's what we try and say in the editorial. So I think that, we're only a bunch of journals, but I think what we can do across our portfolio of 20 or so journals and your portfolio of hundreds, Jessamy, is that every act of resistance matters. Every attempt to defend science, defend scientists, does make a difference, and I think that's our role, and it has become ever more important in today's world.
What was the state of the Venezuelan health system like, even under Maduro?
Unfortunately, it's very difficult to be sure because they destroyed all the epidemiological surveillance. So there's very little data that one can actually rely on to tell you what the situation's like. But what we do know is that there have been rises in malaria incidents. So infectious diseases have surged back in many parts of Venezuela. Access to essential medicines is extremely poor. So people are not going to get the quality of care that they should be able to get for a country like Venezuela. And then advanced specialist services, they just they simply don't have the specialists there. Something like 7 or 8 million people have exited Venezuela during the Hugo Chavez and Maduro era. There's no question that their governments stood for something that was very positive and meaningful in the sense of trying to defend the rights of the poorest and most marginalized people in Venezuela, in many rural communities. But in doing that, they have destroyed a health system that now is not able to deliver basic care. And by basic care, I mean primary health care and the most fundamental essential services. So not only are 20 million out of 28 million people living in poverty, but a very large number of the population are just not able to get that access to basic care. So this is where it's a humanitarian emergency. And America might come in and talk, we're talking all about the narco state and oil and gas and Maduro, but actually somebody needs to be talking about the people, and nobody's been talking about the people.
Well, I feel like I can ask you about any health system in the world and you'll have a pretty good answer about how the health system runs, which brings us on nicely, I think, to India. And we recently published a commission. So why don't you tell us, well, let's start about how did the commission come about? Why is this a good time for this commission about health in India?
Yes, so we published in 2011 a series of papers about the Indian health system calling for universal health coverage in India. It was a fantastic series. It was led by a guy, good friend of the Lancet, Srinath Reddy, who led the Public Health Foundation of India. We're very fortunate. He was Manmohan Singh's personal cardiologist. And so when we went to launch the series in Delhi, we actually got access to Prime Minister Manmohan Singh himself and presented it to him in person. But I think the truth was that we were going to the top of the hierarchy in India. It was a very, very technical series, and it didn't actually make too much of a difference. I think some of the ideas got incorporated into the 2017 National Health Strategy, but it was a very top-down approach and a bit of a technocratic approach to trying to reinvent India's health system. So this time, this project was led by somebody, again, who we know very well, Vikram Patel, who's based in Goa, and is also a professor in Harvard. And Vikram wanted to do a kind of bottom-up approach. So this was a commission. It's called a citizen-led commission on the Indian health system. And it really starts from the people and analyzes what the problems are for the people and then tries to build up from that. It's been a 5-year initiative, started at the beginning of the pandemic, and it's been a complicated project to do because India is a complicated country. It's 28 states. It's not just one country. It's like 28 countries in its own right and a whole bunch of separate territories. And a lot of the health budget is devolved to states. So it's not like China, where if you've got Xi Jinping and he makes a decision, then that's what the whole country does. It doesn't work like that in India. This is the problem of democracy, is that everybody has a voice, and that slows things down. So it makes this kind of project more challenging. But that said, the authors navigated trying to bring together the public and the private sector, which was one of the most difficult predicaments they had. The system should be based on the public sector, free access to healthcare at the point of demand, but there is a very vigorous private sector, which is where the elite and many of the middle class use. And of course, if you've got a vigorous private sector, then the political attention is not put on the public sector because there's no demand. So we need to strengthen the public sector, align the private sector to the public sector. And this is what the Commission's tried to argue. So we launched it in Delhi a couple of weeks ago. We had a fantastic symposium for a day. We didn't present it personally to Prime Minister Modi, but that's okay, because what we want to do is not have a top-down approach. We want to take the Commission to individual states and try and put the recommendations of the Commission into practice in those states and take a few exemplar states, and that's what we're going to do in the coming months.
Any highlights from your whirlwind visit to India?
Yes, several highlights actually. First of all, the Jaipur Literary Festival. Jaipur is about a 3-hour drive southwest of Delhi, and it's organised by this Brit, William Dalrymple, but it is the most fantastic literary festival that I've ever been to. Mostly Indian and South Asian speakers. There are a sprinkling of internationals. We had a session at the festival on the Commission, led by Vikram Patel. But it was just a fantastic way to see a different perspective on the world. You get so rooted. Here we are in London. You see the world through London's eyes or the Anglophone eyes, and you go and you see the world in a completely different way. For example, India. We're all talking English, but the fact is India is a country with hundreds of separate languages, and there were many sessions talking about the hegemony of the English language and how that destroys literary traditions and cultures. And of course, we don't tend to think like that. We take for granted our English language. But you go to India and you realize that actually colonialism is still very much alive and operating on a day-to-day basis. So it was a revelatory visit. And I think the second revelation I had was I had the same feeling in India in 2026 as I had when I first went to China around 2006. That is to say, this is a country with enormous energy and a lot of money and is on the move. India's economy is one of the fastest growing economies in the world of any comparable nation. And if you look at the growth of their scientific output, number 1 in the world is China, number 2 is the United States, but number 3 is India. And it's not another European country, it's India. And India is growing at 14% output every single year, the same as China. America's growth, flat, 0. European countries, flat, 0, even negative in some. So, this is a country that's moving fast. Sure, there's a quality issue, but there was in China 20 years ago. They'll fix that, and they are fixing that. And remember this about India. 60% of vaccines in the world, where do they come from? India. 40% of generics in the world, where do they come from? India. It is the pharmacy of the world. And it's a digital technology superpower already. So, I think, we all get obsessed about China. We all get obsessed about the United States of America, and everybody forgets about what's going on in India. And it's a super exciting country.
Let's just dig into that a bit more, because obviously China, India, similar populations. India's the most populous, but China, very closely behind. Massive, massive population, massive amount of young people in India, less so in China because of historical, family planning. But when we look at investment in science and research and healthcare, and you think back to your time in 2006, are these countries on similar trajectories when we're looking at that type of investment in infrastructure and in health and science research?
Not yet, is the honest answer. But maybe I'm unfair by saying that. I mean, if I try and think back to 2006, the government wasn't, I didn't think about Peking University Medical College or Tsinghua University or Fudan or any of the great universities in China in the way that I do now, they had not matured and flourished, and the government wasn't taking them as seriously as certainly they do now. And it's true that in India also it's hard to name universities that are of that international caliber. And also I think the balance of where the research is done is different. So it is right that in China there's a lot of investment in medical and life sciences. In India, it's more on the physical sciences, computational science, and less so on the health sciences. So there is a sort of different agenda. But again, I think this is where the opportunity comes for India. This massive economic growth is creating this fiscal space, and that fiscal space can be invested in health, in research, in education. And certainly the middle class, which is now, hundreds of millions of people, which it wasn't some years ago, is clamoring for that. Their aspiration is to have health, education, universities, exactly like China. So I feel although it's different and although it's more complicated and more fractured, I still came away feeling very, very optimistic about the future and that we need to be there.
And what about this aspect of, one of the findings is that kind of these, averages of data of improvements on things is hiding these very deep disparities because of this very pluralistic way that they're running their healthcare system. So you have massive disparities in delivery and in quality. What did you see when you were there that felt like people either really calling to change that or to address it? And what are the levers that could be pulled?
Well, I think the answer to that is not enough. So I do find it astonishing that a country can allow 640,000 under 5 children to die every year and there aren't protests on the streets. That seems pretty shocking to me. But this is a country that allows that to happen. And under 5 child survival is not a mainstream priority that you see debated in the newspapers every day. That said, certain things are priorities. So I was in Delhi for a week. Every single day on the front page of the newspaper, there was a story about air pollution and how this was not being tackled by the municipal authorities or the government, and the things that they were trying to do were utterly failing. So, people sometimes say that the Modi government has created a culture of self-censorship and the media isn't as free. I hear those stories, but I tell you, on the front page of the Hindustan Times every day, the government was being held accountable for not addressing the severity of air pollution. So there is a vigorous and vibrant media. It does hold the government accountable. I just think it's the issues. Health is not an issue of political salience like it is, for example, in the UK. The NHS is number 1 or number 2 issue with the economy in any political debate. Well, it sure isn't in India, and that is a problem. And I hope that what the Commissioner can only make a small contribution, but what I hope it can do is to encourage more health activism, more demand for government action. It is surprising to me that there is this passivity around the issue of health and that people aren't demanding better services.
Are there any political science? There must be lots of people that have written on that, of countries in different stages of their development in terms of what people's GDP is and the priorities in their life, and therefore how likely they are to demand better healthcare, whether it's viewed as a luxury rather than as a necessity.
Not that spring to mind, but the question of demand is very interesting, isn't it? And the salience with which these things come to the front pages, like you said. What's your perception of the kind of stage that India is at then when it comes to demanding, say, getting all the way to universal healthcare being the number 1 or 2 most important thing in the country versus where India currently is?
Yeah, I did ask this question of many people I met. So, in China, there's no doubt that the demand, for a young family in China, they want to have better schools and better healthcare and better housing and better jobs for them and their family compared with their parents. So China took 800 million people out of poverty, this massive middle class suddenly created with this driving ambition and aspiration to do better for their families compared with their parents. And that's driven the system. You know, this is where, for the Chinese Communist Party to stay in power and for Xi Jinping to maintain his leadership, he knows he has to satisfy the demands of the people.
So you think it's an equity economy issue?
I think it's a political issue in the sense that there's this massive middle class with these massive demands, and the government has to satisfy those demands, and they know that the way to satisfy those demands is by investing in these services. I mean, the way it was put to me many years ago was Mao created the borders of modern China, Deng Xiaoping created the economic miracle, and the job of political leaders today is to keep this show on the road. And the way you keep the show on the road is you keep people happy, and that means meeting their aspirations around health, education, jobs, homes, and so on. In India, it's a bit different. In India, they have this goal of Viksit Bharat, which is getting to a developed economy by 2047, so the centenary of independence. So they really have a national mission, and they're really, a clear goal that by this date, we're going to make it. And everything is directed towards that. But they haven't pulled 800 million people out of poverty yet. They don't have that middle class that is literally banging at the doors of government saying, you've got to give me schools, education, health, and so on. But it's growing. It is growing. I think also in India, and somebody said this to me when I asked them about the 640,000 under fives and why aren't there protests in the streets. And he said, look, Richard, you've got to understand, we've come from being basically, you guys in Britain destroyed our country. You extracted all of the wealth from our country. We were one of the richest countries in the world before you guys came. You destroyed all of that. We were a country at independence that was basically in poverty. And how do you psychologically deal with that? The way you psychologically deal with that is that you just have to say, this is fate. This is how life is. You just have to accept it. So this is the way somebody's put it to me, there is in our psyche a sense that this is what one has to accept. Now, you're building this middle class that does have this aspiration and this demand, and that's going to change. It's not changing as fast as it's changed in China, but it is changing. And I think that's the hope for the future.
It is interesting, though. We hear all the time about New World Order, multipolar, blah, blah, blah. But the same thing is happening in health. And, we're comparing and contrasting India and China. Been reading that book Breakneck by Dan Wang. I'm just on the one child policy chapter, which is out of this world, really, the figures of abortions that were carried out. But that is very recent history, that a government was having a direct impact on women's ability, on sterilizing them, on aborting their fetuses. And yet almost within 10 years, we're saying, and I know that it's different because it was very much more rural than the urban classes, and presumably when you're saying middle classes demanding healthcare, we're talking really about urban middle classes,
absolutely,
rather than rural.
No, absolutely.
But this transition between accepting that a government is going to be able to dictate how many children you have and to physically take you into a hospital and abort your second child, to demanding a certain level of healthcare within 10 years. Is mind-blowing. So I think what you're saying is absolutely right. We might be sitting here in 10 years' time, and it's a very different situation in India in terms of that demand and what is required by citizens.
Absolutely. I left feeling the energy in this country and wanting to go back and experience it. Absolutely. It felt really, really a moment of optimism. But I want to change tack for a moment, because we talked about Jessamy's new job.
Yes.
But there's another new job here in the room, and that's Gavin. You've got a new job. Tell us about your new job.
Yeah, bring the cake out, get the streamers.
Come on.
I'm senior editor now at the Lancet Global Health.
You've crossed the line.
I have. I've crossed the line from comms into the light
The
side
brightest
of editor, the
of
brightest
sides.
side
of
editorial. And I started doing that in October.
On Lancet Global Health.
On Lancet Global Health, working with a wonderful little team over there, led by Zoe, our editor-in-chief, who's been editor-in-chief of the Lancet Global Health since...
She's the founding editor.
Since it was founded.
That's
so,
right. Absolutely.
It's been an easy place to come into because, it's very... it's a very well-established journal, and all of the research that I'm helping authors work with now is so interesting and fascinating because, it deals with these vulnerable populations. So it's so much of what we publish is this incredibly worthwhile stuff that hopefully will make a difference to vulnerable populations around the world.
But listeners may not know, I don't want to sort of just read out your CV, but you have a PhD in political science. So you're bringing a very, very unique perspective to the work of global health, which is really important, not just the politics, but the fact of a more social science and maybe qualitative research perspective to the work that is done at the journal. And actually, not just at the journal, but you will have an impact on the whole organisation because you join our manuscript meetings and other meetings. So
yeah, I've really actually been surprised by how easily, I guess, that kind of background, my background in politics and policy, has slotted into what the Lancet Global Health does. Because, it publishes, obviously, randomized controlled trials of drugs in particular populations, but it also publishes quite qualitative work that overlooks how policy interlocks in different countries or different regions of the world. And I'm handling a really interesting paper at the moment, for example, that's a qualitative overview of the entire, they call it the vein-to-vein system of blood transfusion, the blood transfusion continuum in Kenya. And it's interviews with hundreds of people who are involved in that situation. It's, full of quotes, full of how can we make actually the entire continuum better. And it just makes you think of the sort of work that can be done in these areas that's not always quantitative. We have to kind of figure out where the problems are before we can address them with quantitative work in quite a lot of areas. And I did a podcast for the Lancet Global Health recently as well as part of a fantastic issue on implementation science that was looking at working with indigenous populations in Guatemala. And I spoke to the lead author on that paper. And what was really fascinating about talking to her was she was talking about the extent to which the quantitative work that they eventually did, which was mental health interventions in an indigenous population in Guatemala, would have been impossible without the qualitative base that they had to build the work on, because they had to go into those communities, they had to talk to leaders, they had to talk to families, they had to work out where their knowledge base of clinical work with mental health interventions overlapped with the knowledge base of mental health interventions among the local populations. They all had to sit down in a room and work out where the overlap was, what was possible, and then how you can build the kind of clinical, almost westernized knowledge of mental health interventions into these particular settings, which are so different compared to how you would deal with mental health interventions in a more clinical hospital-based setting. And it was just really fascinating because it just really made me think that work like that is not only so important, but this qualitative base that goes hugely underappreciated, I think, is the foundation of work like that. So I think we need to make more space for qualitative work.
Couldn't agree with you more. And one of the criticisms of the Lancet as an idea is that we follow a very biomedical model and that we don't do exactly what you are describing, take a more descriptive, phenomenological approach to the world in which we live, and instead impose all of these experiments or quasi-experiments on it rather than just observing.
Meeting people where they are.
Exactly. That's beautifully put. So, I mean, that's what you're bringing to the group, and fantastic. And I think I'm looking at what you've got in front of you. Is that one of your first papers that
this
you've
actually... This is the first paper that I've taken from start to finish to publication. But it actually does build on a paper that The Weekly published last year, which was the paper modelling the USAID cuts and the impact that they would have in low and middle income countries that were not reliant on USAID funding, but it formed quite a large part of the health systems and health interventions in that country for some really high impact conditions. And so what this paper does is kind of build on that base. But what I think is really important is because obviously the USAID cuts kind of dominate the headlines when it comes to overseas development assistance. It actually expands the analysis out to include all of the cuts in Germany, France, and the UK and other countries. The funding from those countries contributes roughly 70% of all of overseas development assistance. But there's some really striking figures when you get past thinking about just the US contribution to USAID. So the USAID cuts have been roughly 56% of USA overseas development assistance to all of these countries that are being looked at. But then the UK's cuts, which get virtually no headlines whatsoever, have been 38.9% of the UK's total overseas development assistance funding. So when you think, on the one hand, we've got these huge headlines about Elon Musk going in and, as he says, feeding USAID into a wood chipper, actually the UK is not that far behind in terms of its cuts for overseas assistance.
Because it's all gone into so-called defence.
Exactly, yeah. And then 36% for Germany, so very similar to the UK, and 18.5% for France as well. And in the words of the authors, similarly large decreases for nearly all other donor countries, with only a few exceptions. So it's a real broadening out of that article in the Lancet from last year.
Who did this work?
Yes, it's David Roessler. And so the way that the work was done for listeners who are catching up was that they looked at the period 2002 to 2021 to see the extent to which overseas funding saved lives during that period. You know, we had huge gains made in under-5 child mortality, for example, and then removing certain percentages of that funding and looking at how that might have an effect on lives from 2025 up to 2030. And they ran 3 funding scenarios looking at a severe defunding model, which projected the current cuts and then followed by further substantial cuts, which is quite likely, I would say, up to 2030. They had a mild defunding scenario, which was the same cuts as are currently in place, but with a kind of stabilization just after that. And then a kind of business as usual at 2023 levels, which is when all of these cuts started happening really across the board. And in the severe scenario, they found that the likely excess mortality would be 22.6 million people up to 2030 from these cuts, 5.4 million of them being children under 5. So it falls to a huge extent. You know, so much of this funding goes towards maternal and child health in these countries. And obviously those are, as we've talked about before on this podcast in the past, those are the major, incredible headline gains that we've made over the last 20, 25 years. So it's a real dialing back of...
Can I be a devil's advocate?
Please.
So we've received papers similar to that, making projections and drawing scenarios for the future, all terribly apocalyptic. The bit that is missed out from the analysis is, okay, so you've cut ODA. What you haven't factored in is that the recipients of ODA may now, as a result, assume their responsibility and exercise their sovereignty and start to fill the gap that ODA was filling before.
Which is the really important point to make, isn't it? Because there's an excellent letter, which I've actually got in front of me as well, in the Weekly, in a response to your original study from Daniel Krugman and Seyab Imbola, talking about how this is such a kind of colonial way of thinking. You know, the only way that these lives could have been saved was this kind of heroism narrative of the West intervening with this money.
Right.
Whereas actually, if you look at it from a positive, not if you look at it from the sense of these places having agency, which obviously they do, it's a chance for them to build these structures up themselves in a way that's so much more sustainable than relying on the whims of Western political back and forth.
And even worse than that is the whims, but also we create parallel funding streams, parallel monitoring and evaluation streams, parallel accountability streams. I remember I was at a meeting, it was to do with the Global Fund. And of course, the Global Fund does fantastic work. I wouldn't take anything away from what it does. I want to be the strongest possible advocate. But the result of what the Global Fund often does is it gives a slug of money to a country, and then the government will not unreasonably say, well, we've just got this slug of money from the Global Fund. Now we're going to take all the Ministry of Health budget, take it out of the Ministry of Health, because now the Ministry of Health doesn't need its budget, and we're going to spend it on education or something else. Yeah. So what happens often is that this ODA displaces national health budgets, which of course is crazy, and that's not what you want. You want to actually strengthen the sovereignty of nations so that they have complete control over their destiny. And ODA, in a sense, pulls the rug from underneath the country.
Absolutely, it's a very valid piece of modelling, and it's important to show the extent. In some ways, I feel like it's almost a positive display of how ODA has helped over the last 20, 25 years. And I know you were just talking about how it has displaced Ministry of Health budgets in some cases. But it is, I think, in a broader sense, making the case for these cuts not going ahead.
Sure. It shouldn't be either or, should it? But it is the way we do it. And the way that the ODA, the governance around the ODA, and the way the money is distributed, and who has authority over that money, that's part of the problem. It shouldn't be the donor who's saying to the country, this is what you're going to spend your money on. And very often it is. What should happen instead is that the money that comes from the donor should go into the bank account of the country, and then the country decides what to do with that money, not the donor. But too often, that's not the way it works.
We have actually commissioned a linked comment to go alongside this, which hopefully by the time this podcast comes out will be live. This paper was fast-tracked, so the comment's not quite ready yet. Right. But Sylvia Kiwiwu-Mayingo has written an excellent comment about the agency of low and middle income countries in these situations, and how this is an opportunity for them to reorganise in a more sustainable, more sovereign way that doesn't rely on overseas aid.
Yeah, and John Kaseya from Africa CDC, he's an absolutely brilliant advocate for this, in a sense, renaissance of sovereignty in Africa, and the fact that this is a big moment for African countries to assume a leadership role domestically and internationally, which they've never had before. So I think he would see this as a moment for them to seize. Accepting, unfortunately, though, that the savage, precipitate nature of these cuts has, as you described, definitely led to and will continue to lead to unnecessary deaths.
Yes, it's kind of that the sudden nature of them is such a problem, isn't it? Because ideally, you would want a kind of tapered pullout that allows recipient countries to rebuild these systems in a way that's more sustainable and works for them. But that simply hasn't happened. Lots of these programs, as we've heard in the news, have just stopped overnight and just caused complete chaos.
Yes, I mean, I remember somebody saying to me, this was in South Africa, they were receiving funds for a program of work, sex workers giving advice around HIV, and they were being paid not to do sex work, but indeed to work in this NGO to give advice. The funding was suddenly cut, and now these sex workers are now going back doing sex work, putting themselves at risk of violence as well as acquiring HIV. So, I mean, these have had materially appalling impacts on people's lives.
But we seem to be at a moment where the whole world is reorganising itself. You know what I mean? As we talked about at the very beginning, these structures that used to kind of not govern the world, but help us understand the position where everyone sat in the world and how structures and countries interacted with each other have fallen apart. And if you look at it in a positive sense, it is interesting and important moment, because now we have to start building a different future.
Yeah.
I prefer to look at things in the positive way like that, Richard.
Yes. No, I do too. But the rise of
I can sense a butt coming there.
Populist politics, and it feels quite hard to retain that optimism at the moment when we're going to have Prime Minister Farage in the United Kingdom, President Le Pen in France,
She's legally barred from a standing. So.
Well, all right. Jordan Bardella, he will become the next president. You're seeing this this rise of a populist right-wing politics that is going to promote the national interest over the way we look at the world, which is the importance of cooperation and globalism. And how does one win that argument back again? We have to admit, those woolly-minded liberals, of which the Lancet is full, that we lost that argument. We didn't bring people with us.
We lost it, but we also, I think, were complacent. We were lazy, and I think we wanted to have it all. We failed to realise that most people, if they wanted to have great jobs, be super international, have all of these values that they could hang on a coat peg and say how fantastic they were, at the same time as having relatively low taxes and not investing in schools and not investing in healthcare. You can't have all of those things together and leave behind a whole group of people whose lives haven't improved over the last 20 or 30 years. So I think I was in a meeting last week with some really lovely people from the army who were medics, talking in a way that is, it's self-righteous, but there's also so moral and so many good things that they had to say. The link between kind of military spending and advancements in medicine, which is very real in trauma care. But talking about the world in this very structured, archaic way of politeness and values and what was good and what was moral. But at the same time as always wanting to make sure that they didn't pay too many taxes, always wanting to make sure that their kids could go to private school, always wanting to make sure that their lives were not impacted while they carried on sort of supporting a structure which was really disadvantaging a whole group of people. And I feel we've not grappled with that yet. And what can we expect but populism when we haven't delivered? We haven't delivered to people better healthcare materially in the UK. We haven't delivered better education to them. I don't know what else we can expect really from a lot of people.
Maybe what we have to expect is that we will see populism put into power, a whole set of politicians that certainly here we don't particularly admire, and watch them fail.
Absolutely.
And it will be out of their failure that
something
there will
else.
be a renaissance of understanding that there are no simple solutions, and that actually it is better for countries to work together, and that it actually is better for countries to form unions.
Yeah.
And that the idea that there's some beautiful nirvana of being an independent sovereign state in this world is a myth.
But also that for the middle classes and for the aspiring classes, that you can't have it all. You can't vote for successive cuts in public funding and carry on in a rules-based order that you aspire to. There has to be more sacrifices on all parts.
There has to be an ability in the political class to have a serious conversation with people rather than say that you can have these cuts and also have these services when the two things just simply don't go together.
And I'm afraid, although I do, of course, love the idea of living in a democracy, it doesn't mean to say it doesn't.
What's coming next?
Well, there is a but, because I find myself getting increasingly infuriated, actually in a rage, about the way the media exploit political issues for their own
100%.
narcissism. And, the rise of the journalist as a political personality.
Commentator.
And it's, just look at the number of podcasts that have proliferated. We're on a podcast here at Editorial, so I have a certain sense of observational irony about this comment. But, every political journalist of any channel in the world has their own podcast. And they get attention by being critical, and the more attention they get is correlated with how critical they are and how extreme they are. And so some of our most cherished institutions, like the BBC, like Voice of America and NPR, get destroyed, and they are the glue, the fabric of society that conduct a conversation amongst the people. They end up getting destroyed or attacked by populist media or politicians or journalists who it's more about them than it is the issue. And it makes me mad to turn the radio on in the morning and hear these journalists criticising a government, in our case in the UK, that's only been in power for 18 months. You know, at the beginning of a 5-year term, with a 14-year inheritance of austerity and having destroyed so much, and they're trying to reconstitute literally life in this country, and they're not being given the chance. And I feel, and I think you're seeing the same, the way the media has treated the Biden legacy, which is portrayed as some sort of communist takeover, which is obviously ridiculous. So it feels like the media doesn't give governments a chance. So I don't think we have a healthy media landscape either.
I was just thinking how my ideal job would be a New York Times opinion columnist. You know, they get paid like a mid-six figures to write a factually incorrect opinion once every 2 to 3 days. I think it's a dream.
But it's also difficult, isn't it? Because you go. I mean, I feel like even the statements that I've made during this podcast, I go into anything with a certain amount of anxiety that we're going through this extraordinary period of change, and you can hear things that sound quite definitive and straightforward, and you're like, oh yeah, that's right, that clarifies it. And then you reflect on it later and think, actually, no, it's such a complex time right now with so much change. You almost wish that we could just sort of look at it for 20 years from now and be like, oh, that was what was happening. That was what we were living through. And it's very difficult to see it.
Yeah, well, I think we are going through a transition.
We are.
I mean, neoliberalism began with Thatcher and Reagan. Actually, neoliberalism was the parent of globalization. And now we're seeing the end of globalization and therefore the end of neoliberalism. We're in this transition now to this new era of it's all about nationalism, and all the global institutions are being defunded and destroyed and marginalized. So, and now it's every country for itself. And
I mean, don't forget the Board of Peace, though, because that is going to keep everything together. So
the new United Nations. And this era that we're now moving into of extreme nationalism and force will win out, that is a very, very scary world. And especially for a Brexiting country that
has nothing.
That is literally floating in the middle of an ocean.
It wasn't great timing.
It wasn't great. That's the understatement of the podcast. Exactly. So we're really in trouble. And this is an opportunity for Europe, actually, to assert itself. It was interesting. The day I was leaving India, the hotel I was staying in, as I checked out, Ursula von der Leyen was checking in. Because she was the chief guest.
Was she next to you at the check-in desk?
she wasn't next, but literally all these military people were outside the hotel, and I said, "What's going on? Hundreds of people with very, very large guns were in the car park of the hotel." I said, "What's going on?" "Oh, Ursula von der Leyen's coming in," because she was the chief guest for Republic Day. I was leaving on the Friday and she was coming in for Republic Day on the Monday. And the point is that Europe does have global leadership. They were just striking a new trade with India. They've just struck a trade deal with Latin America, the Mercosur deal. You know, Europe does have leverage here. And I think there's a set of European values. Europe has a civilization.
I think that's what we need to tap into more is what is it that we stand for? And we've had difficulties with public services and health and everything else, but what is it about Europe, about Britain, where we are, or any of these other countries that we can say this defines our future. These are the ways that we want to live, and this is what we can deliver, because we don't have what China has. We don't have what India has. We definitely don't have or want what America has. So what is it?
Well, I think the attempt within the EU at the moment to create a kind of second track of the countries that are committed to tighter integration and that kind of European ideal is sort of an extent to realise that. Because so much of EU policy is thwarted by outliers like Hungary, who have a veto, and obviously don't kind of cohere to the general values of the central EU countries like Germany, France, Spain, etc. That this creation of this second track, I think, is actually an attempt to kind of grasp that nettle of, 6, 7, 8 countries that are all very, very big financial powers, but also on the same level to the extent that they are kind of able to operate as this one block, which the European ideal hasn't quite worked in terms of constant expansion with the coherence to operate as a block in the way that you're talking about, I think.
I feel like the Lancet could do something in this space, Richard. Commission or series
on the future of the world.
On the future of the world, yeah.
I'll leave that one to you.
That's how we should end.
Yes. Well, okay. Well, thanks everyone so much for listening. Thank you, Richard. Thank you, Jessamy, for joining me again. We'll try not to leave it 6 months before the next one because I enjoy doing these. But thanks everyone for listening.
We'll solve the problems of the world in the next podcast.
Exactly.
Yeah, maybe we'll think about it in the interim and come back with some solutions. Thanks so much for listening. We've put the links to the papers we discussed in the show notes if you want to check them out, and hopefully we'll see you back here on the Lancet Voice next time.